Hi everyone, you're listening to Let's Psyconnect. Some of you might actually be watching us because we did a Zoom meeting not too long ago with a special guest, Laura Lu. In a little bit, we're going to introduce her to all of you so that you can benefit from all the knowledge that she's going to share with us today. But today is going to be a special episode. We're going to talk about intergenerational trauma. But before we get to that, let's talk a little bit about trauma. What is it? What we associate when we hear the word trauma, right? Because trauma is an umbrella term, and it's used to describe maybe one single event or multiple events that someone has endured in their life. And it can be psychological trauma, physical trauma, sexual trauma, emotional trauma, right? We cover more about that on our PTSD series. And not every single trauma is going to lead necessarily to PTSD, like the diagnosis of PTSD. And we talk a little bit more about that in our series as well. But we do want to share with you guys here that traumatic experiences, right, it entails a threat to one's life or safety or sense of safety, or they also witness something happening to somebody else. And it comes with a feeling of being overwhelmed, and as I said, the threat, the fear. It can lead you to also physical sensations, maybe a heartbeat, or maybe the sweating, as a physical response to what's going on and how your mind is processing, or maybe not even processing full what's going on at the time of the event or after the event as well. We also talk about trauma when we refer to domestic violence, right? When there's a car accident or multiple accidents, as the one who was behind the wheel or as the one who was outside of the car too, right? Regardless of the position where you were in that given accident, it's going to be an event that is going to impact your life, and it can influence the way that you see yourself, the world, and your future as well. We also talk about trauma when it comes to different generations. So that's where we're going to talk more about today, intergenerational trauma, also known as transgenerational. And I'm sorry about my English here because I'm trying my best. It's a bit more like...
Doing perfect, Lucy.
So I'm going to try transgenerational trauma. So basically, it talks about how trauma, it has the unique ability to be transferred from one generation to another. And with that, we are going to introduce you our guest speaker today, Laura Lu. So go ahead, Ronnie.
Yeah. So first and foremost, thank you so much for coming here with us today, Laura. We're excited to get into our conversation, and I know our listeners are super excited as well. But before we get into that, I do want to give you a formal introduction. So Laura is a graduate student studying clinical psychology in San Francisco, California. She's originally from Taiwan and immigrated to Canada at a young age. She graduated from the University of British Columbia in Vancouver, Canada in 2017, and has since worked in research settings in infant language development, bilingualism, and ADHD. Laura has also worked in clinical settings in ADHD, autism spectrum disorder, in patients diagnosed with HIV or AIDS. So due to both Laura's personal, academic, and professional experiences, she is passionate about incorporating a culturally informed and sensitive lens on mental health. Right now, Laura is conducting research looking at the effects of adult and child trauma, trauma treatments, and intergenerational trauma. She just wrapped up research looking at trauma responses toward the results of 2016 U.S. presidential election. So Laura hopes to finish her schooling and gain her PhD so she can become a clinician and a researcher, which she's well on her way to doing. So welcome to the podcast and IGTV, Laura. How are you?
Good. I'm super excited to be here. Thank you so much for having me. How are you guys doing?
Good. We're thrilled to have you here and talk about an important topic that I don't think is well discussed enough in the public eyes, and even at the clinical field as well. Let that be PhD training or PsyD training. I think I first talked about at one of the clinical settings where I was at getting my training, and my supervisor brought on this topic, and it just, that's how it started, like, to develop my awareness of the term and how it can be of interest in terms of determining what proper intervention to apply, when treating a patient.
Yeah, absolutely. And I totally agree as well. I don't think it's talked about nearly enough as it should be. And I only learned about it like halfway through grad school myself. And I think this is very timely as well. I'm excited for this podcast because right now we're facing a movement, and there are lots of things going on in the world. And so we're really starting to unpack the layers of trauma that can, as you said, be generationally just passed down. And it's so interesting. I'm not sure if you two know this, but today is June 19th, which is Juneteenth. And today is kind of the anniversary of when slavery ended. So we can talk a little bit about that too, about intergenerational trauma in the slavery context.
Yeah, would love to, for sure, because it's relevant not just to what is happening in the world right now, but I think it goes across, because I'm from Brazil. We had slavery over there too, and it has affected my country in so many ways. But of course, around the world too. I'm not going to say that it didn't happen. It happened in so many other countries as well. So even though we don't necessarily have a June 19th, I think the topic in itself can be applicable in other countries too. Yeah.
Exactly. Yeah.
Of course. And I'm excited just touching on this because it is such a new field of research. I think just in terms of trauma research overall, intergenerational trauma is not something that I've seen come up a lot in terms of articles that I've read through, even in classes. And it took me until my third practicum to actually really hear the term and start to understand what it means and the implications it can have, as you said, of LT and treatment recommendations and progress. So with all that being said, Laura, just give our listeners kind of a general understanding definition of intergenerational trauma as it means to you and just from your work.
Yeah, so I think you gave a really good summary, LT. Intergenerational trauma is basically the idea that traumatic effects, and those include either PTSD symptoms or non-PTSD symptoms, and how they can be passed down from generations to generations. So you can think of, for example, maybe your grandmother's generation, or maybe even more like your great-grandparents' generation, when they experience something in their environment that's traumatic, it can actually be passed down, not just in their behaviors, cognitions, psychological means, but also in their genetics. And as you said, Ronnie, this is a really new emerging field of research. We call it epigenetics, when our behavior interacts with our environment, which interacts with our genes. And it's really pervasive. There's a lot of research coming out, more and more research every day, that's showing that this effect is actually pretty long lasting and it's substantial. Intergenerational trauma isn't just like a dulled down sort of trauma. Of course, it's not going to be as obvious as if someone experienced like a car accident or sexual assault and immediately has like flashbacks of that specific incident. But the other types of behaviors and symptoms can be really pervasive.
Yeah. I mean, thank you for that picture that you painted right there, and you made it in a way that I hope that a lot of listeners out there were able to understand. I think that the language that you used, it was in a way that, again, relatable to most people, for sure. So I appreciate that, because it's
of course
difficult sometimes to describe big terms in our field. And correct me if I'm wrong, and I mostly am wrong when it comes to this, because I don't know much about it. But I have the understanding that I think what is known, or the idea of maybe impact of an event passing through generations, I think a lot of that is talked about when it comes to the Holocaust. And I don't think a lot is known yet when it comes to other events that have happened, and it's they are known around the world. So tell us a little bit more about that.
Yeah, so actually when I actually am doing my thesis topic on intergenerational trauma. And while I was doing research on this, just looking at the literature, you're right, most of the literature does focus on Holocaust survivors. And it's amazing because this population, I guess you could say, is a really good opportunity to study the effects of intergenerational trauma, of course, because, you know, there was such profound trauma and torture and abuse and neglect, all different forms of trauma, not just looking at like one type of trauma, but also like, you know, different severity levels, different types. And so we could get a very comprehensive picture of trauma from that. But as you said, Ronnie, in my bio, one thing that I'm really passionate about is bringing in a culturally informed and culturally humble lens, not just to my work so far and my learning, but also I think to research. And one of the criticisms that a lot of people pose with that research is that intergenerational trauma exists not just in the context of the Holocaust, but all different cultures and all different countries. And you know, countries have pretty awful histories, I have to say. So how does the culture and the specific context of the person interact with intergenerational trauma? And so that stuff we're less clear about. There's some research on, as I said before, on slavery. There's some research on, in Canada where I live, there were the Indigenous residential schools, which means that we call them First Nations people, were basically captured and taken away from their parents and brought into schools, and like horrific abuses happened. And so there's a little bit of research on that, but as you said, LT, not a lot. Most of the research is on the Holocaust, which I think is, you know, that just proves that more needs to be done in other areas.
Yeah, definitely. And I think I'm so excited to see what research and what articles are birthed from this topic, from this conversation. As you mentioned, many countries have a past that aren't necessarily utopian fields, right? And we can think about World War I, World War II. We mentioned slavery in multiple countries all across the world, and the list just goes on and on. And I'm always careful to generalize findings, especially something internationally, but you have to wonder, you know, how much these effects have on the current population now, right? If we know that the Holocaust has brought on multiple kinds of intergenerational trauma, I would like to presume that that is the same with other large events in the world's history.
And it's sometimes when we're talking about an event, a given event that happened in the history of a given country, like slavery, and then people say, oh, but it happened so long ago, you know, why are people still talking about this, you know, why are you still bothered? And it's just, anyways, let me hold my composure here.
It's a passionate topic.
But the point is, you know, if it's a Holocaust, if it's slavery, the wars that are happening in other countries around the world at this given time, you know, there are lots of countries that are still undergoing a war, and people having to seek asylum, oh my gosh, you can say that word now, asylum in other countries, and whatnot, and that has an impact in other generations that are yet to come, you know. So it's so important. So thank you again for talking about this. And
of course,
you can tell us now, what are some of the things that research has shown that intergenerational trauma is associated with in terms of maybe risk factors, and then you can tell us a little bit of the mental health components too.
Yeah, definitely. So as you said before, and I'm super excited that you have a PTSD series, because I really want to check it out now. But as you said before, the thing that trauma is most connected with that we know of right now is post-traumatic stress disorder. And I'm sure you're going to talk about that in your series, but for those of you that don't know, just a little bit, just a series long. But yeah, for some of you that might not know, post-traumatic stress disorder is oftenly thought of as the disorder that, for example, soldiers might have when they return from war. And in pop culture, it's commonly thought of as shell shock. So you can think about, having nightmares, having flashbacks, having like really heightened physiological responses, like maybe sweating a lot, having your heart rate up when you have reminders of the trauma, all different types of symptoms. And it's important to realize that when we're talking about trauma, not everyone's symptoms are going to be the same. So everyone might have, like, I might have a different set of symptoms than someone else who maybe has experienced the exact same trauma as me. And this is dependent on a whole bunch of factors, like how I was socialized, my biology, my previous intergenerational trauma, all of that. And so when we think about PTSD, we can really categorize it into two different categories of symptoms. And these two categories are intrusion symptoms and avoidance symptoms. And the intrusion symptoms are the ones that I talked about. So like flashbacks, nightmares, intrusive thoughts, just constantly just being heightened and like having a very aroused nervous system. And then the avoidance symptoms are really interesting. So the avoidance symptoms can be efforts to really avoid the environment that you're in, or it can be a sense of like feeling numb or detached from your environment. And yeah, there are other avoidance symptoms that can be actually quite adaptive when you think about it, but it doesn't actually solve the problem of facing your fears. You just tend to like avoid things, or people can often dissociate in instances of trauma where they forget about the trauma completely, or again, feel kind of detached and split off. And so it is important to remember that these PTSD symptoms can actually manifest in intergenerational trauma, especially the numbing and the physiological symptoms of it. And so that's something that's definitely connected. Another thing that research has shown that's connected to intergenerational trauma as well is anxiety and depression, sometimes suicidal ideation. And a lot of the time people have no idea why these things are coming up, because they're like, well, I didn't experience anything bad, why am I at risk now for all of these mental health disorders? So I think that's really important to note. And one really interesting research finding is that intergenerational trauma in this study actually has been traced back 14 generations prior. And so when we think about, your comment about, wow, the Holocaust was like hundreds of years ago, slavery was hundreds of years ago, like, why are people getting so upset? It makes sense, I think, on a biological and psychological level, why people are getting upset still today.
Yeah, and Almaris, thank you for sharing all of that. There's so much that I want to point on. And I did read about, you said the PTSD and how it is passed on through generations. And you talked about the epigenetic component of it, how it transfers from generation to generations via the genetic position. And they did find some genes that are associated with stress and PTSD, and so how that is passed on via generations in comparison to those who didn't experience that traumatic event or even events that happened in history. So
yeah, that's super interesting.
So it gives a different perspective to look at things, right? It's very relevant. It's very present in that in that family that is living through generation, right? Because then you have your mother, your father, whoever is in your family that went through something, and they will tell the children, but then will tell the new generation. They will tell, and we do understand that history, the way that we tell people about something, it might change, right? That phone component that this
telephone, changes
a little bit, but nevertheless, the intent of the content, which is the traumatic experience, is going to be passed on. And depending on how the conversation goes, then you might not learn the coping skill or how to process that new information, right? And the agent in which you learn that information to can also have an impact on how you're going to absorb that information and then later on pass it on to somebody else as you tell that story too.
Yeah, exactly.
Yeah.
And I think it's super interesting the way you brought up how like the genetics can also interact with like the psychology of things. And I think when we talk about intergenerational trauma, it's not just genetics and it's not just psychology or, you know, how people are socialized, but it's all of them. And I can see how, you know, if a trauma occurs in one generation, that generation will not only experience the trauma themselves, and that'll be like genetically and biologically passed down, but maybe that parent, for example, starts teaching their child implicitly or explicitly that the world is dangerous and that there should be things to be feared in the world. And so in psychology, we call these things schemas, like how we, how our thoughts are kind of organized in our minds. And this schema of the fact that the world is dangerous can also be passed down through parenting. And that is also kind of an effect of intergenerational trauma. Although it's not direct, it still is there. So there's lots of interactions there.
Yeah. So, and I think that you two both highlight the point that yes, there is a genetic component, right? And we know that, we can observe it, research points to it, and it points to how important the context or the environment is in which this individual grows up in, right? So even if that genetic disposition is there, it doesn't necessarily mean that it will come out, right, in any overt way, but it really depends on, and I heard this term used before, genetics loads the gun and the environment pulls the trigger, right? So it's important as mental health providers to really understand the context of what's going on in this individual's life, the neighborhood, the type of schooling environment, anything that could directly affect that individual.
Yeah, because I think sometimes we talk about, okay, what culture do you come from? And let's say, okay, so you're from Brazil. What are some of the aspects of the Brazilian culture that has influenced you? But I don't think we necessarily think about many aspects of past events that have occurred in my culture that have influenced me because of how my past or previous generations have endured and experienced those events.
Yeah, and sometimes people don't know. They're just not educated.
A lot of people, I think.
A lot of people, and it's, I mean, this is a little bit of an aside, but I think our education system does a really bad job of educating people about some cultural history that's really relevant. Like I never learned anything about Asian Canadian history in Canada, and that was like huge, right? And going back to your point, Ronnie, I think it's really important that gene environment interaction, that's what we call it in the psychology world, where, you know, if you do have trauma in your ancestry, that doesn't necessarily mean that you're just like screwed, essentially. And there are ways to kind of combat that. And there are also ways to kind of shape your environment so that you can be protected against that. And as you said, just because the genetic kind of, what word did you use? Like the gunpowder or something like that? Is there something about a trigger? Doesn't mean that it needs to go off, right?
Yes. It's a predisposition. It's not activated necessarily, but in some people might be activated. And you said that
exactly
you can do to not necessarily be activated in a high level. It can be down.
Yeah, exactly. Yeah. And I think this is where people really need to start thinking about re-traumatization. And I'm seeing this all the time right now. And I mean, I'm biased because I work in trauma. I've worked with people who have had trauma before. And I know that just seeing images of reminders of your trauma, even if it is like from generations ago, can actually bring up those symptoms,
Right.
those negative reminders, and just mental health concerns. So when I see people, for example, like sharing videos of the police violence that's happening, I understand that those videos hold a lot of power. But to me, and I'm getting pretty opinionated here, to me, when you don't put a trigger warning or something like that, someone could be like just browsing their feed and just be re-traumatized by those things.
Yeah. And you made a point here, and then maybe other people out there don't see that point of view, and I get that too. You know, I mean, there's several ways that you can interpret that and perceive that experience, like as you scrolling through your feed and then you see that video. But I think that coming from a mental health professional point of view, and knowing the impact of an event can have in somebody's life, and then again, you work with trauma, so you know what it's like, you know, in terms of what the patients are telling you, and how important it is to provide interventions, because it's much needed to provide interventions to these patients.
Sure.
And so, yes, it was really hard for us to watch this type of videos without the warning, without a conversation behind, right? And without being mindful of those patients of having those type of experiences and what those videos can do to those patients again.
Yeah, absolutely.
Yeah. And you did talk, go ahead, Ronnie.
Sorry. So before we move on to our next question, I did want to intervene right before I forget. So you mentioned the presentation of an individual who could be displaying symptoms of intergenerational trauma. And I think that, so what came up for me is how important it is as a mental health provider to really go through the steps of doing a biopsychosocial and understanding the patient in front of you in a holistic way, right? Because some of these avoidant symptoms or underlying symptoms of the intergenerational trauma can be seen as depression or maybe anxiety in some ways. So if that is then diagnosed incorrectly, then the treatment is not directed at the intergenerational trauma, and therefore treatment outcomes may be affected. So definitely want to do a complete biopsychosocial and really understanding the patient you're working with.
Yeah,
exactly.
Absolutely. I think that's such a good point. And I mean, I'm not super well versed in this because I'm just beginning my learning in this field, but some of the research that's come out recently is actually linking trauma with ADHD, which I think is super interesting. I worked in ADHD for several years in a research lab and a children's hospital for ADHD. And I think a lot of the research thus far had been about kind of the brain mechanisms behind ADHD and the biological component of where ADHD comes from.
Right.
And so I think it was super interesting for me to read that there was recent research done on ADHD and how trauma can be a factor. And I mean, not the only factor. But yeah, I think I see this as an emerging field as well.
Yeah, and I think that is going to bring, I mean, of course, we're not going to elaborate so much, you know, right now, but the fact that you're talking to us right now about ADD and then trauma, and I think it's just going to help people see ADD in a different way, you know, and how to approach like via treatment to that patients suffering from ADHD. Yeah.
Yeah, definitely. And I think with an intergenerational lens, I mean, this is just a speculation of mine, but I have seen research showing that Black children are more likely to be diagnosed with things like conduct disorder or oppositional defiant disorder, which are seen as more like behavioral not symptoms, but like signs of like talking back or displaying like aggressive behavior, whereas non-Black children are more likely to be diagnosed with ADHD for the exact same type of behavior. And so you can think about things like diagnosis bias. You can also think about the intergenerational trauma link there of like, the link between aggression and intergenerational trauma, which is actually quite strong, surprisingly.
Yeah, well, thank you for sharing that too. And it goes again, you're telling us about these schemas, right? And how a parent or a grandparent sees the world as unsafe, right? They're not protected, and people are going to do this to me. And so they pass that on to other people too. And so that can interfere the way they interact with the world. And I think there's something, I think the term is called stress trauma too. There's the community component of it, that the fact that they feel so afraid that they have to do things just for that community to feel protected and feel safe.
Mm-hmm.
And then pushing, not necessarily pushing, but like protecting themselves from the outer world because it's unsafe.
Yeah.
Yeah.
Go ahead.
Yeah. I'm sorry, but it's almost like a mistrust of society, right? And because of that mistrust, you are more willing to be closed off and more unwilling to be accepting of maybe other opportunities, right? Or going outside of the community because you have this underlying feeling of mistrust that whatever happens, what my parents told me or my grandparents told me, it's going to continue the same cycle. And I think that leads to a lot of self-doubt, right?
Yeah.
Definitely.
And you mentioned the police, right? We see that when it comes to the police, we're not to trust the police because this has happened to my aunt, my uncle, this person, that person in my community. And so I'm going to protect myself and I'm going to protect my community. And I see people as police officers as people of, danger to me. And again, I'm not saying that they are wrong, it's to blame them, as victims or survivors. It's just to understand their mindset. That's, because it has been shaped via generations and via experiences.
Yeah. And I think that's a really fantastic point that a lot of people don't really realize. A lot of discourse is happening right now around like, oh, maybe abolish the police or like defund the police. And there's a lot of people, as you said, that don't trust the police or don't even trust like institutions. And I think that part of it does perhaps stem from intergenerational trauma when we think about groups of people that have been really abused and hurt by government institutions in history. So again, not blaming the individual, but really trying to understand where that might come from, because awareness as mental health providers or even as policymakers or people that want to protect the community, we can see, okay, well, having this awareness of where this distrust happens can help us move forward and serve people better.
Yeah. Is anyone might wonder like, oh, just change the way you think about the police or just change the problems on you, right? And again, it's like we're not blaming them, it's understanding how these things come about. And again, it's a culture, it's a systematic thing that has been so ingrained and has been passed on through generations. And then it's not simply just like changing one individual, like the way they think and see police officers or whoever.
Yeah.
Much more to it for sure.
Yeah, definitely. And on that note, it is, I think that's one of the reasons why it's so hard to work with trauma survivors as a clinician as well. In clinical psychology, and definitely in my program, we talk a lot about transference and countertransference, which is basically the feelings towards a therapist or a provider from like the patient's perspective, and the feelings that the therapist or provider has towards the patient. And in a lot of trauma survivors, there can be a really strong distrust of the clinician, and sometimes not even consciously, but again, it's kind of on that schema of like, oh, the world is dangerous and people are, especially people who have been hurt by people they have trusted in the past or generations ago, now have this massive distrust towards people that seemingly want to help them. So being aware as a mental health professional of those is also really important.
And sorry, I'll see we keep and the general public having that awareness as well. And LT, you alluded to it earlier. It's really difficult to say to somebody, stop thinking that way or change that pattern of thought about the police or about the community.
Mm-hmm.
We know, because we're having this conversation and up to date with articles. But that is, I mean, we're talking about multiple generations here of that same mindset, the same thought processes. So to break that takes, I think, a lot of introspection. It takes a lot of work internally. And we're doing a disservice, not us, but some people may be doing a disservice by saying, you know, that's incorrect. Change your change the way you think about it, right?
Mm-hmm. Yeah, absolutely.
And I was going to mention here, because we're talking about the relationship between the therapist and the patient. And so the patient comes in and already sees also the therapist as someone of power, right? With and so it creates a distance between the patient and the therapist too, and another obstacle. And then I've been hurt before. So the patient is thinking like, I've been hurt before by other people in power, right? Or if you are a therapist of a white background, like white European descent, and it's like, I've been hurt by people just like you know, and then what are you going to do for me now? You know, like, you're just going to hurt me. I can't trust you. So it definitely starts off in a way that it's damaging to the relationship. Nevertheless, you know, with some skills, with training in the professional side, it is possible to build rapport and build that trust in that therapeutic relationship. But it's just, you know, it gives an idea that it can interfere because of the way that you see the world. It can come in play a role that it can be negative in that relationship. Yeah.
Yeah, definitely. And I think you're so right about, because I think a lot of people, I've heard a lot of clients and just people in general say that they prefer maybe a therapist that shares their own cultural background or is a person of color. And in my previous practicum last year, we had a service where you could actually request like what preference you wanted for a therapist. So maybe you could request like a female or like a you know, an LGBTQ individual or a person of color. And I think most of the people that were assigned to me did put down a preference that they wanted a provider that was a person of color. And so I think, you know, that could be for a lot of different reasons. It could be because, you know, they want the therapist to kind of get it and get what their cultural experience is, or at least get something close to that. But it could also be from fear. And as you said, like trauma that's intergenerational based on a distrust towards certain races. So yeah, you do bring up a good point there.
Yeah.
Not to say that there aren't clinicians that can't work with clients of different races or different cultures and backgrounds. I think that can be done so effectively.
Definitely.
And I mean, my therapist is white and she's amazing. So I think that it's definitely important to acknowledge that and become aware, and as a mental health professional, never assume that you know someone else's experience, especially if you're from a different ethnic group.
Yeah, and I mean, just because I'm Brazilian, if I see a Brazilian patient, you know, I can't assume that I know everything about what the person went through just because it's from Brazil, and Brazil is such a large country too.
Yeah.
The same, I have actually challenges on patients in the past, you know, just because you're from Brazil doesn't mean that I know everything, you know.
Exactly.
Your story, right? Teach me, like share with me, so I can see through your eyes. It's different, you know. It's not the same necessarily. It won't fit in one specific box.
Exactly. Yeah.
And then there are different therapeutic approaches to address power and privilege, you know, which is amazing. And as mental health professionals, it's important that we become competent and know how to address power and intergenerational trauma and cultural backgrounds and race, right? Racial trauma, so that we can use that to, again, facilitate therapy and facilitate the patient's growth.
Yeah. And I can even think about a few therapeutic approaches that do utilize more of like a social justice perspective. And there are definitely like clinics out there that kind of advertise like we're a social justice informed treatment center, or, you know, we utilize feminist therapy, things like that. But I also think that each therapeutic relationship should actually be aware of these things, even if you're not treating someone who has conscious awareness of their you know, cultural trauma or intergenerational trauma. I think it's so important as providers just to like assess first and like really understand the person and constantly seek to understand before we say like, oh, here you go. Here is your treatment.
you have intergenerational trauma. What?
Yeah. I'm going to prescribe you.
It's just the new approaches, and we can talk about this in a whole different episode here too, right? That's not the focus, but I think that it does bring about like the way that we can help those patients experiencing intergenerational trauma, because power does come into place when it's something that the patient is bringing on to the relationship, to the therapeutical room, but also outside of home too, right? When it comes to, again, talking to police officers, talking to a professor or somebody else, that where they see it is, okay, this person has power, I don't have power, therefore I'm going to, behave this way. And if we can maybe find a way to also share some of those approaches, and not call it therapeutic approaches, but more human approaches in a way that it addresses the power and bring the connection, rather than like you are there, in one way and I'm here, we're distance, we're different, and you answer to me, you do a lot.
Yeah, I agree.
We're talking about several things here too, and there are some recommendations. Anything else that you'd like to share with us today? Maybe like we are all students here, right? So what are some of the things that maybe you can tell other students when it comes to this topic, and other maybe professionals too, just to like, again, understand the topic a little bit better?
I think in terms of intergenerational trauma, as we discussed a little bit before, the field is so new and the field is always changing. And like research from like 10 years ago might not be relevant now, or there are certain aspects that are relevant and that are not. And so I think as a student, just constantly trying to be on top of the research and really kind of take a critical eye to research. That's really important, especially since what's challenging about psychological research, and I think maybe the public knows this, maybe not, but for things like intergenerational trauma, when we have to dig deep into the past, it's quite hard to claim that like, oh, this causes this, because we're digging deep into the past of someone's life, and there could be like all sorts of different research explanations for something. We can't make what we call in psychology like an experimental design. We can't design an experiment where we traumatize someone and then study their children. That's not ethical and not possible.
Unless we go back to the past. We have to
build a time machine. Yeah, that would solve a lot of research problems, actually. So yeah, I think one thing to really note is that research is super important, but also taking a critical lens to research is really important too, and kind of building your knowledge from like a variety of different sources. And something to also just provide like anyone who's listening right now, even though intergenerational trauma is very serious and pervasive, there are definitely ways to heal. So I don't want people to know that, oh yeah, like my ancestors suffered this, or like my great grandmother endured childhood abuse, and that means I'm going to be like, mentally ill or anything. I think there are definitely therapeutic and non-therapeutic ways to either protect yourself or to heal.
Yeah, I think this is great. You know, we are to talk about like, hey, there's hope, right? Just because we went through a trauma event doesn't mean that you can't recover from it. Doesn't mean that you can't work on your schemas in a way that it's going to be of work for you, right? It's going to be, it's going to be beneficial to you. Raise awareness of it, understanding your symptoms, understanding what's going to happen or when you pass it on, or what might happen, right? Because we don't necessarily know the future, what might happen as you pass it on to other generations, to understanding ways that you can educate your community and others of your community or of your family of what happened to you, about what happened to you. And so that, again, it's not necessarily like passing on the trauma in a way that it's going to be you against the world, but in a way that it's going to be something that, yes, it has shaped my experience. It has shaped my life. It doesn't, my life is just going to be that, right? Your life is much more than that. And then so talking about that too, I think it's something of importance so that we have better ways to cope. We have better ways to think about and feel our traumatic experiences and deal with the past traumatic experiences.
Yeah, and I think another component to that is talking about resentment. I was reading an article and it talked about intergenerational trauma and the aspect of resentment or what could occur, right? And so, again, being aware that that is a possibility and that is completely normal, right? And when things happen to us that we necessarily feel that we didn't have a direct effect or a direct choice to occur, that emotion of resentment can come up. So working through some of that and understanding that that is normal, right? It's to be expected, and to kind of forgive yourself for feeling that, right?
Yeah. And I think it's really about us as mental health professionals, and I think you do a wonderful job in terms of advocacy out there too, via your Instagram, and we'll tell you all where to find Laura in a little bit too. It's again to work against this biases. This stigma against. What I'm trying to say here is that to work against and raise awareness for the mental health stigma, and so that we can break that stigma and then invite people, right, and foster a culture where people can actually come and seek our help and see therapy as something that it's good, right? It's something that it doesn't, because you went through something negative, then you're sick, or your life is this or that, you know. It can also be because you're doing something good and you just want to share that with somebody else too, right? So I think it is very important that we as mental health professionals, again, raise awareness and continue to talk about this topic, something that invites people and bring people's life.
Absolutely. And I think just the last thing I want to say is, and it's so interesting you brought up Instagram, because I literally just posted a post about this topic, is the fact that, and it's so interesting because I work in a lab called the Trauma, Stress, and Resilience Lab. And a lot of times I'm really doing research and focused on the trauma, and I almost forget about the resilience part. And so intergenerational trauma is pervasive and it's really serious, yes, but there is intergenerational resilience as well. And resilience does exist within like personalities and bloodlines, and can be passed down from generation to generation. So that's kind of a little glimmer of hope there too.
Yes, great, thank you. Thank you so much. And,
great way to end this.
Exactly, great way to end it. I think it's a good time to wrap this up, and we just want to thank you again for Psyconnecting with us. We're just so thankful again that we can connect with people via psychology and people that we've never met before, right? And you're in Canada, we're here in the US, you know, it's just like bringing us together in a way that we want to share with the world something beautiful. And I hope you guys, you know, enjoyed our conversation today too. So again, Laura, thank you so much.
Of course. And I love that name, Psyconnect, because that's exactly what we're doing right now.
Exactly. So I'm just going to say a couple of words here. I hope you guys stay Psyconnected with us in between episodes. We are on Instagram, Twitter, as well as Facebook. Let's Psyconnect, all one word, lowercase. Visit our website, letspsyconnect.com. And if you guys want to request any of the studies that we talked about today. I know we didn't necessarily mention the author's name and whatnot, but I'll talk to Laura about maybe sharing some resources. And if you want to have access to them, send us an email, discussion@letspsyconnect.com. Laura, tell our listeners and our viewers, where can they find you?
Oh yeah, so I run a mental health Instagram account, and the handle is the Mind Health Spot.
Okay, and if you didn't get that, that's okay. It's going to be posted on our episode description as well as on our social media accounts. And remember, let's connect.